Welcome to episode 172 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. Today's episode is part of my Back to School series, which features interviews with 9 pharmacists who teach online courses. Up next is Dr. Stu Beatty. During our conversation, we talk about the Pharmacist Provider online training program. If you are interested in providing reimbursable services to your patients, regardless of practice setting, you need to listen to this episode. A link to the training program is in the show notes, which you can find on thepharmacistvoice.com. Just click on the podcast tab and search for episode 172. Thanks for tuning in. And now, here's my conversation with Dr. Stu Beatty. Hi, Stu. Welcome to the Pharmacist Voice podcast. How are you?
I'm doing well. Thanks so much for having me, Kim.
My pleasure. I'm excited to hear how you use your voice as an educator in the online course realm. But first, Stu Beatty, would you mind explaining who you are and what you do?
Sure. So I am a pharmacist by training, and I live in Ohio, and I've been on faculty at a large academic institution for a number of years now because I'm getting older. My background there is I have practiced in a primary care setting, so practicing alongside physicians and helping to educate students, educate pharmacy residents and medical residents, but really in this very team-based environment has been my background. I've really enjoyed and love that. But recently, I've pivoted and used some of that experience to work in the state of Ohio on Ohio provider status, working with the state association and helping pharmacies, pharmacists implement services, working with plans to help educate them on what pharmacists can do and why we should be getting reimbursed for those services, which has led into my newest endeavor, which is launching an online training program to help pharmacists learn how to become a pharmacist provider, start new services, and actually be reimbursed for the services they provide.
Can you tell me a little bit about the course? What are the basics?
Yeah, so the course is going to be it's an online course. It's the whole thing is designed for adult learners. It's meant to be very application based, and there are recorded sessions that are all roughly 20 to 30 minutes of time. So again, it's designed for a working pharmacist, it's designed for an adult. There are some interactive things that are intentionally put in there. So hopefully you can hear about the content, and then there is a worksheet that goes along with all of these sessions so that it'll have you pause and then you can fill things out specific to your own practice setting, and build off of that. So the sessions are going to be things on how to actually start a service. There will be sessions on billing and billing codes and how to actually be reimbursed for your service. And then there will be a few sessions with some just general things like motivational interviewing, documentation, some of the basics that pharmacists are going to need to know in order to actually become this pharmacist provider that we all want to do to really use our education to take care of patients.
Excellent. Boy, I'm so curious about this. This is a long time coming, isn't it?
This is a long time coming. This really started, and I've had this idea since I've been working in this provider status space, and started working closely with pharmacists, and pharmacists have all this knowledge and this training about medications. But because this is a new world we're moving into of actually starting to get reimbursed for this, most pharmacists don't have the training of how to actually start a new service or how to implement a service or get paid for that service. So those interactions of working one-on-one with pharmacists in both community settings, independent pharmacies, FQHCs, all of them, it really came to like, here's some basic needs that I think pharmacists are going to need to move this forward. So hopefully that's what we have in our online training program.
Great. What is the program called? Where can people find it?
Yeah, I guess I probably should have mentioned that. So thanks. It is it is the Pharmacist Provider is the name of it. So it can be found at www.thepharmacistprovider.com.
It's such an intuitive name, isn't it?
Yeah, I know. Very creative.
Hey, you know what? It talks about what it is,
That's right.
when you complete the course, you should be able to be a pharmacist provider.
That's
So
right.
why not call it the pharmacist provider? I
That's
love
right.
it.
Thanks.
You're welcome. Stu, who's the ideal client for the Pharmacist Provider online course?
Yeah, so the ideal client is again, it's going to be the working pharmacist. So that may be somebody that graduated within the past year. That may be somebody that graduated from school 20 years ago. The whole thing, as I mentioned, is designed for the working pharmacist, the adult learner. And most of the material that is in here really isn't taught, at least in detail, in current pharmacy education because it is new, and if it is taught, it's taught more in the classroom setting. So hopefully what we have with our sessions is it's more applicable to where you're working today. How do you build your service today as a working pharmacist? You want to start a new service, you want to start taking care of your patients in a new way, you want to start getting paid for taking care of those patients. You can go to this program, sign up. Again, it's going to walk you through these sessions, have these application based exercises, and joining worksheet where you can apply that directly to your setting today.
Now, is this only for pharmacists? I know you said for working pharmacists. Can anybody else take it? You know how sometimes there'll be an interest from a one off provider, nurses, physicians, assistants, etc.
It's designed for pharmacists. It does have pharmacist continuing education credit assigned to it, so you will get CE by doing this. I think that the things that are in there are applicable to other medical professionals if they wanted to start a new service as well. But it certainly is designed primarily for the pharmacist at this point.
Okay. And what settings do these pharmacists who this course is ideal for work in?
I think it's really applicable to any setting because the material that's there of starting a new service, it's very general, but it needs to be applied to your direct setting. So there certainly is going to be information. Most of the pharmacists work in the community setting, whether that's an independent pharmacy or a chain setting or a grocery store. But it certainly can be applicable to those that work in a clinic, or maybe you want to start working in a clinic, or you want to approach a hospital, or you want to approach a physician's practice or nurse practitioner. It certainly has the material that's in there that it's really applicable to any setting.
And how does this connect with collaborative practice agreements in Ohio?
So collaborative practice agreements are something that we currently have in the state of Ohio. It actually is one of the requirements for payment. We're trying to get that changed before I kind of switch back and forth with my advocacy hat here. Collaborative practice agreements are something that is extremely important for us as a profession, I think, and it really aids to an efficiency of practice, of being able to have some autonomy to be able to make some changes to therapies in collaboration with physicians. It In my opinion, I feel very strongly that it should not be tied to payment. We should be able to be paid as a pharmacist for what the knowledge that we have in helping a patient out. And there are times that can be changing medication doses and adding therapies. There's other times where it's just talking to a patient about, hey, you should really change the way you're taking care of your diabetes. And if you drink less soda, is one of the things we've seen our pharmacists do, it's had a significant impact on their health. So that doesn't have anything to do with a collaborative practice agreement. Our pharmacists just need the incentive to actually go out there and talk to patients in a new way. So they need to be paid for those things so we can actually get patients living better, healthier lives.
I love that you're focused on the patient outcomes. That's a really pure intention. And thank you for sharing that.
Yeah,
Now, Stu, you're an Ohio pharmacist. I'm an Ohio pharmacist, but this is an international podcast.
yeah.
You're going to have listeners from all over the place. So I just want to clarify, is your online course only for Ohio pharmacists?
It is not, and thank you so much for asking that question. It's obviously based on the knowledge and the experiences that I've had here in the state of Ohio, but there is nothing that is on this program that is specific to Ohio at all. It really is general information that could be used by pharmacists in any state. Now, there are, as we start to continue to move forward with provider status initiatives, there may be things in your state, there may be things you need to meet. You need to look up your own laws. Even if you're taking this program in Ohio, you're going to need to look up the laws of Ohio and make sure that you're following those rules. But the whole purpose of this is, how do I actually start it? Because you can go to a CE on what's the law of how to do this and what do the rules say. But what we've seen is people really need those tools and those skills to actually go out and start doing this, and that's what this program is really designed to do.
I love hearing that. It almost hints at the fact that there may be patient cases in this course. I have not seen the course, but are there any patient cases? That's my favorite part of going to CEs and stuff because it applies the
Yeah.
information.
Yeah. So when I talk about some of those different things about building that service out, there aren't necessarily patient cases, but there are cases in there about, okay, so if you're in this particular setting, who are the people on your team? Here's this particular person. How do I use this technician in a new way to build my service out? Now, when you start to move into some of the other things like the documentation, some of the things like on billing, there are case examples that are built in through that. So patients can hopefully learn the material. And then there's an application case where they can go and be like, okay, how would I actually pick the code that I would use to bill for this particular service? And they can apply that right away.
Examples are so powerful. I'm
Yeah.
so happy to hear that you have those in there. Now, as an online course, I know you are teaching this and you've got modules, but how about the students? Are they able to talk to one another? Do they know that one another are out there? What kind of community are you building along with this?
Yeah, so at this point, I mean, we'll kind of see how this goes as it's going to be a new endeavor. But I would love for there to be a community of people that can talk on either discussion boards or some type of chat room and have that functionality. I'm not sure how many people are going to sign up, so people like you are going to help get the word out, which I love. But we'll see how that is. I know that from our experience again in Ohio, we talked to a lot of our pharmacists early on about doing this, but that community feel of having like monthly phone calls to touch base, share ideas, what are best practices has been extremely powerful to move that forward. So I'm certainly interested to have something like that as we move forward. There isn't at this point a built-in time period for that because it's really designed to be asynchronous and to work with. When do you have time to do this? Is it on your lunch break? Is it in the evening? Is it when your kids are in bed? Is it when you're on the treadmill? Like whatever that is, it does have that asynchronous feel. So there isn't anything that's built in, I guess, along with the coursework, but I can certainly see something like that happening in the future.
Well, that's great. That's how the course will evolve. And it's kind of cool to leave that door open because as your students give you feedback, I'm sure that you will take that and you will use it to help them.
That's right. That's the whole purpose is to get the pharmacists that are taking this to go back to taking care of patients the way that we were trained to in school. Get away from just having to be paid from dispensing a medication and actually get paid for taking care of a patient the way really all other healthcare providers do, except for pharmacists. So,
One benefit I can see for you as the course developer would be to find out what your students' issues are, what
mhm.
their pain points are, and then develop more modules that will be included in the course accordingly. So it's a great opportunity, but first you got to get it out there.
Yeah.
And when will the course launch?
The course will be launched this fall of 2022. So I would say like September, it'll definitely be launched. October, look for it then, which I think is about the time this podcast is going to go out. So the timing of this works out great. But it will be available this fall. And then what you said is exactly right. So based on our experience, we hopefully have the first set of modules that, from things that pharmacists needed as this moves forward, we're going to hear from people. We're going to learn new things. We're going to put things in there on billing. But if there are new services, new niches, new whatever that may be, we will be developing more content and that will come out as it moves forward. So I love what you said because that's exactly the intent of this. It's hopefully going to be a one stop shop for if you want to be a pharmacist provider, this is where you can go to learn about how to do a service, how to bill, how to document. All those various things will continue to come out of this program.
Awesome. Good things come out of Ohio, Stu. I love
That's right,
it.
that's right. Good things come out of other places too, but good things do come out of Ohio.
That's true. I just can't help having a proud moment here.
That's all right. I'm an Ohio proud too, born and raised. So
Yep, same here. But good ideas spread, and I totally understand what you mean. There will be good ideas elsewhere, which is why eventually collaboration is going to be powerful. And I look forward to hearing about all the success of this. Hopefully, when it launches, it just goes out the gate and sells like gangbusters.
yeah, yeah, and people should know. Obviously, I'm based in Ohio, and I'm behind this, but it's not just me. So I have other experts that have contributed to this, and have contributed to these sessions. So it's certainly is I guess my brainchild, but there's a lot of other brains that have gone into this as well.
Yeah, well, congratulations to your team on the success of the whole entire course. Yeah, it
Thank you.
certainly takes a team.
Absolutely. Thanks so much.
You're welcome. You had me smiling big earlier when you were talking about doing this on a treadmill. I was about to say, Stu, how do you know I do my CE at the gym?
Well, again, I'm an adult learner as well, so I know how this works. And the good thing about having something online and asynchronous is we have so many more devices, and being able to do things like podcasts and being able to watch a course and do that within our time. It's really important for us to be able to continue with our lives. So maybe it's sitting in the parking lot while your kids at practice. I mean, I have kids. We all spend a lot of time doing that with our devices now. We can put in AirPods, whatever it is, and maybe we can watch a course that's applicable to what we're doing. So it really is designed to do that. That's why we went with the big portion of this is online. That's why we want it to be application based. So hopefully it fits to people's lives wherever they may be.
Yes, and you mentioned that it's asynchronous, which is fantastic. People can do it at their own pace
That's right.
24/7, right?
Absolutely, absolutely. So if you want to do this at 3 in the morning when you can't sleep, then you can do it at 3 in the morning when you can't sleep. But yeah, absolutely. That's the whole purpose of it being online and web based, is people can kind of go and do it as they please. But there is an order to it. So there's this worksheet that goes along with it. If they need to go back and listen to a session again, they certainly they can do that.
Now, is this the type of asynchronous learning where you have to unlock step 2 after you complete step 1 and then step 3 comes after that? They can't just jump around? What's it like?
So it's set up that they could jump around if they want, but there certainly is an order to it, especially for that's the initial launch for this primary service development. There's kind of there will be 10 sessions that will be launched. Of those 10 sessions, 7 of them are kind of a build your own service out. And they do kind of go in order. There's an overview, and then it kind of goes into how do you market, and then how do you evaluate it. And there again, there's an accompanying worksheet that's going to go right in line with that. But it's very possible you may get to session 4 and you may be like, oh, I need to go back and listen to session 2. It's hopefully designed where it's building off of that, but I can see where people may want to go back and do that. Or they're filling out this worksheet in session 2, and then they get to session 4. They need to go back and cross something out and put some. It's all designed for that. You don't have to turn this in. I'm not going to grade this. This whole thing is for the pharmacist that's taking this to go out and build a service. Again, from our experiences, you really have to start small, but you just have to start. So we're providing you with the tools to go out in there and start something.
I appreciate bringing a little humor into this. As pharmacists or pharmacy students out there that may be listening, we've all completed assignments that are graded, and you said the worksheet's not graded, but something is. I understand that there's pharmacist continuing education
That's
available
right.
from this.
That's right. So it is ACPE accredited. There will be so of the sessions, they're all designed to be a half an hour credit. So again, for the adult learner, you only have to spend 20 to 30 minutes on each one of these sessions. But yeah, you can get your CE for this. And as we continue to add more sessions on, we will be doing continuing education. We realize that's an important part of it. We would hope that people would want to do this without the continuing education, and they just want to do this to start a new service. But we also know that as pharmacists, all have continuing education responsibilities we have to meet. So if you're going to be taking this, then why not get the continuing education you need to keep your license active and again move your profession forward at the same time?
Yeah, great points. Going back to the whole treadmill and the asynchronousness and everything and the worksheet and having a certain flow to it, let's talk about misconceptions. Some people may think, oh, this is great, I can jump around. But as you add more courses to this, will you add more structure to your worksheet so that people understand you really should do part 1 before you jump to part 2? Talk a little bit about the order in which things should be done.
Yeah, absolutely. So I think it's as far as a misconception. I feel like when I talk to a lot of pharmacists right now about provider status, they're like, I need to know the billing codes. I've never billed before. Teach me the billing codes. And we can certainly do that. And that's one of the things this session's going to go over. So if people want to jump right to the billing codes, they can. My experience has been you really need to back up You really need to go through, how do I develop a service? It's very different than working on a workflow for dispensing. Even if you've done immunizations at your pharmacy, that's something that you may have some experience with. This is going to be a little bit different. How do I think through using my staff the right way? How do I think through making sure I know how to document and keep that stored so the next time this person comes in, I've got it available for me? All those things are really, really important pieces. And it does walk people through, again, this kind of step by step process to do that. So that once you're doing that, now let's learn about the billing codes and actually have some examples about, I'm seeing a patient doing this and that. This is the billing code that I pick so I can be reimbursed, but I've got the whole structure set up so that my service is going to be successful on the front end.
Thank you for explaining that. You know, pharmacists are rule followers and a little bit perfectionists, and we do care very much about doing things right. So, thanks for laying out how it's structured because I think that's going to help a lot of people understand the right way to do it.
Yeah, I'm a pharmacist, so I know how pharmacists think. I know how pharmacists work, and I know all the pros and cons that go with that. We're great. We're risk averse. We're always thinking about, how can we minimize risk, and that's what we need to be doing for our patients. And the whole program is set up to be able to get reimbursed for us to do that on a big level, because historically we have not been able to do that.
Yeah, it's an exciting opportunity.
Yes, absolutely.
Now, I understand that when a student's looking at this course, they think that they're buying a way to have provider status and bill for having provider status and for services they're providing. Now, when they finish this course, what are they equipped to do?
When they finish this, they're going to learn the basics about setting up a new service, selecting what kind of service they want, making sure that they know up front how they can tell if that service is successful or not. They're going to learn all about, the codes to bill for that service and be reimbursed on the medical side. They're going to learn about the basics of how do they document, what types of things they need to look for documentation. Wherever they're practicing within that setting, they're going to have to work with, if they're the owner, I guess they have control over that, but they're going to have to work with their team. If they work at a chain pharmacy, they're going to have to work with their management to say, how do I set this up within the confines of where I practice? If they're in a certain state, they may have to go and look at their particular state and say, what am I able to do and what am I not able to do with different payers? Again, this is the first of this. So this is going to be moving across the country. There are more and more states that are passing provider status legislation as we speak, which is extremely exciting. We're seeing a lot of different vendors come to the market and offering things like medical billing. So that tells me that there's a market for this, that other people are recognizing this is where the profession's moving. So when you get done with this course, you're going to have that basic skill set to start to build this out.
A lot of pharmacists often need permission to do something, and I feel like they take courses, they look for certifications and whatever that gives them the gold seal that they are ready. And I feel like if there are people out there that need that, and that's just fine, this is a great course for them because I think it will certainly validate that they are ready to provide a service and get paid for it.
Yeah, that's right. And one of my pharmacy mentors always said, "Pharmacy is the profession we're always one CE away from being an expert." So hopefully, what we're doing here, is we're taking all of that again, and I really think when it comes to this, now that we're starting to get reimbursement popping up, we really have to start doing this as a profession. You're not going to switch this overnight. You're not going to go from, I dispense 300 prescriptions a day to now I'm not dispensing at all and all I do is see patients. Like, if you're in that community setting, it's going to have to be a mixture. It's going to have to build. We have to figure out what the balance is of how do you start to carve out time where maybe you're double covered, maybe you're using your technicians in different ways, but I've got the availability to sit down with a patient for half an hour and meet them where they are and provide a new level of care to them. And I know that I'm actually going to get paid and reimbursed for that. And that's what we have to start figuring out as a profession. And that's what we're trying to do with this course, is give people the tools to start to do those things. I think just as a profession, I can't, um, tell you how many times I've been in conversations over the past few years with payers, and the payers are really starting to recognize that pharmacists and pharmacies in particular are a huge access point. and they have this highly trained healthcare professional that's there that historically has not been used, and they've not been incentivized to provide this level of care for their patients. So, we always talk about how we're the most trusted, we're the most accessible. Those things are true, and hopefully, like through this course and the things that are happening across the country, people are actually going to get paid to be the most accessible and to be the most trusted healthcare professional.
And sometimes we feel validated when we get paid. We are
Absolutely.
no longer that doctor on the bench. We're in the game. We're making a difference. We're making an impact.
Yeah, and I'm to kind of build off of that a little bit, Kim. I don't want to say that this is the cure all for all of it, but one of the things we've heard from our early adapter pharmacists in Ohio is they're saying things like, "This is why I went to school." This can help with things like burnout. Like, this may not be the only solution for burnout, but I can get satisfaction knowing that I'm actually helping my patients in a new way, and I'm getting paid to do that. It really is causing a lot of that validation, a lot of that satisfaction. So I think it's a really important part of that other piece of the puzzle, that kind of elephant we don't want to talk about, which is the workforce and the burnout and all that stuff. This can be a really important piece for that, I think.
Agreed. Stu, a lot of pharmacists are self taught in a lot of different categories, whether they're learning about diabetes, hypertension, cholesterol, etc. This seems like something that pharmacists could self teach themselves to be able to do, but your course is so formal and organized and stuff. What would you say to the pharmacist who prefers to be self taught? Why should they purchase your online course as opposed to being self taught?
So the advantage for having this course is, again, we've built this whole thing around the working pharmacist, and we've got these examples that are in there that you can fill out that are specific to your setting. So you've got this accompanying worksheet. When you're going through, you can really think about, who are the people on my team. A lot of times, and I'm guilty of it too, you always end up going back to, like, who's the person that's going to get this done on your team. So you may always go to the same technician. Well, this is hopefully going to force you to step back and be like, in order for this to work, I need to utilize my entire team, or maybe I need to make a new hire or think about hiring somebody that's got a different skill set so I can build this service out. So that's the kind of reason why you can go through this course, and it's going to help you think about all that stuff, and again, set you up for success. I guess in theory, you can self teach yourself to start a service. Historically, I think what we've seen is people that do that, they're not thinking through all the aspects of that service, so it's not always set up for success, and they may get 6 months, a year in, and it just doesn't work for various reasons. Hopefully, what we're doing here is we're forcing you to go through those things up front. Again, instead of just billing, like, think about what that entire service is going to look like. How are you going to utilize all of your team members? So when you actually go to start seeing those patients, you've got it built for success.
Excellent point. Pharmacists are risk avoiders, aren't we?
Yes, we certainly can be, and that's part of our that's
Yep.
a big part of our job. So it makes sense why we're so good at that. But in this case, we need to go, and I always go back to, like, why is this important? And I believe, like, at my core, that pharmacists have this knowledge and this skill set that truly is underutilized. And why do I want to do this? And why do I want to move forward provider status? It's because I truly feel that having pharmacists involved in the care and in the health of patients, we can do it better. It doesn't mean we do it in a silo. We have to do it with all these other healthcare professionals, but right now they're not utilizing us, and things are kind of a mess. So why don't they utilize us with all this knowledge and all this skill set that we have? And I truly believe that having pharmacists involved, we can have better outcomes, and our patients can be healthier for that.
Absolutely. Pharmacists help patients avoid those health outcomes that they don't want. Absolutely. But your course helps pharmacists
That's right.
avoid being self taught and having an initiative in their business that fails. I feel like you're setting them up more for success and avoiding the risk of failure. Would you agree
Yes.
with that?
Absolutely. That's the whole purpose. That's the whole intent, again, to have kind of a one-stop shop where they can learn about all these skills and all these things up front, so that they are setting this up to be successful.
All right. Now, I've got to ask a big question. How much is the investment for this online course, the Pharmacist Provider?
Yeah, so the pharmacist provider, it's you're going to get, um, 10 set right now you're going to get 10 sessions and 5 hours of CE. That's going to be followed up with another probably 10 sessions, which are going to be specific on the nuts and bolts of billing and how to do that. The investment for that's going to be $1,500. You're going to have access to all that. You're going to have access to other things as they come out. As you talked about earlier, if we find that there are some gaps, if we find that there are other things that pharmacists need, we're going to be adding that material in. The thought is that is not going to be an additional investment. Your initial investment will get any future courses as well. Now, if we end up building in some community and some different things like that, we'll have to kind of see where that goes. But your investment of $1,500 is going to get you access to all of those sessions.
$1,500 forever and ever, not just annually?
That is what it is initially. It's going to be $1,500 for that, for the sessions.
Great, great. I'm glad you brought that up.
Yeah.
So, hey, if it helps pharmacists avoid a lot of risk of failure in their own business, I think $1,500 is a fine amount. And I can see the value increasing as you add more content. And possibly if you have a price increase, I can see how that might be justified.
Yeah. Yeah.
Now, Stu, I want to talk about myths and misconceptions. We talked a little bit about that earlier. We
hmm
talked about a misconception, but is there anything that people think they can do with this course that they're actually not going to be able to do with it?
I guess one thing I want to point out this we are not planning and we do not intend to get into the specifics of how do I treat diabetes. So a service that's going to come up a lot, and an example you may use is you may decide to start a diabetes service, which certainly makes sense. We are not going to be providing at the pharmacist provider CE on how to manage diabetes and the therapeutics of diabetes, and that's intentional because we feel like there's so many other things that are available on the therapeutics and the treatment of diabetes. So you're going to have to go and learn about the therapeutics of hypertension or diabetes or whatever service you decide to start. This is not going to be the one stop for that therapeutic stuff. There's plenty of other programs out there to teach you how to do that. And that stuff's always evolving. So this is going to be, again, specific to how do I actually set up and manage this service and make sure that it's set up for the long haul.
Awesome. Now, a misconception that I think everybody makes when they take an online course is how much time is this going to take out of my day? So, can you address how much time these first 10 courses will take someone? I think you said 10, 30-minute sessions. Is there any additional time that they should budget for that?
Yeah, so they're approved for each of the 10 sessions is approved for a half an hour of CE credit. So they are designed to be a half an hour. But again, that is application based. So you may decide to pause. You may decide to come back to your development sheet that you're working on. So really, it's going to depend on what you decide to do with that. I think what I'd love to hear is that people sign up for this and they're thinking, okay, I need to spend 10 sessions. I've got 5 hours. I can allot the time for that, and then what they end up doing is saying, "Oh my gosh, this was great. I went and shared this with my team. We had a team meeting of everybody at my pharmacy, and we spent a couple of hours really starting to talk about how are we going to build this service out." That stuff you're not going to get continuing education credit for, but that's hopefully what's going to happen with this because that's what's actually going to have to happen to build your service out.
Thank you for sharing that. That sets the expectation that this is more than just a CE. This is going to take you time to think about and implement.
That's right. This is really a redesign of what you do as a pharmacist. So that's going to take some time. That's going to take a lot of buy-in from other people, your bosses, your superiors, your interns, your technicians, all of that to truly make this work. It is going to have to be an investment. So by you investing in this course as a pharmacist, you're going to be learning those nuts and bolts, but then you're going to have to take those skills and you're going to have to train other people on your staff to really make that a team-based success.
Well said. Yes. Well, as we start to wrap this up, Stu, is there anything else you'd like to share?
I just want to share that this is a become a passion of mine. As I mentioned, it really is the nuts and bolts of this. It really does get back to I'm betting on the pharmacist, not even necessarily the pharmacy for the future. I'm betting on the pharmacist and this the skills and the knowledge that we have to take care of our patients in a new way. I'm providing a way for people to kind of get back into the nuts and bolts to hopefully help with job satisfaction, with burnout, and have an incentive to actually take care of our patients. That's what this whole thing's about for me. That's why I'm doing it, and I'm hopeful that the pharmacists that are taking this course are going to go out and take care of patients in a better way.
All right. I love the go get 'em attitude. That's great.
That's right.
Awesome. Well, Stu, thank you so much for sharing your passion for advocacy for pharmacists and pharmacists becoming providers. And thank you so much for sharing how you use your voice as an educator here on the Pharmacist Voice podcast. You take care.
Thanks so much, Kim. Thanks for having me.
My pleasure.